Hello, everyone. Today I'm going to talk about a topic which is called migraine. The evidence for acupuncture in the treatment of migraine is substantial and supported by high quality clinical research. Multiple Cochrane systematic reviews consider that the gold standard in clinical evidence that have concluded that acupuncture is effective in the prevention of migraine and also a landmark 2009 Cochrane review, which including 22 randomized controlled trials, they found out that acupuncture is at least as effective as the um, prophylactic medication for migraine prevention with a significant fewer adverse effects. Um, And more recent study suggested that 8 to 12 week course of acupuncture may reduce migraine attack frequency by approximately 50% in many patients. So first of all, I'm going to talk about the mechanism of actions. The the effects of acupuncture are believed to involve the multiple complementary mechanisms. First, acupuncture stimulates the afferent nerve fibers, triggering the release of endogenous analgesic substance such as endorphins and serotonin. And secondly, it modulates the hypothalamic pituitary adrenal axis, helping to reduce stress responses that often contribute to migraine onset. Third, it may improve cerebral and muscular blood flow, addressing vascular and muscular component involved in migraine pathophysiology. Fourth, acupuncture has been shown that to reduce the pro-inflammatory um, the data that actually which are associated with migraine related inflammation. Um, and functional MRI studies also suggested that acupuncture can help with involved in the pain processing, stressful regulation, and emotional control systems closely linked to migraine susceptibility. So, how does acupuncture help with clinically? Acupuncture may be beneficial both for acute migraine attacks for a long-term prevention, for example, episodic migraine, regular treatment, weekly or bi-weekly sessions, and maybe reduce the frequency, duration, and intensity of attack. Um, so before we keep going, maybe if I can find small videos.
AI-powered changes to the Monday platform and what they actually mean. We all know we need.
Hello, everyone, and welcome to Headwise, the videocast and podcast of the National Headache Foundation. I'm Dr. Leitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. Today, I'm lucky to have Dr. Lauren Natbunny on as our guest. Hi, Dr. Natbunny. How are you?
Hi, I'm good, thank you. Thanks for having me.
Thanks for being here. Dr. Natbunny is a board-certified neurologist and headache specialist. She is the founder of Integrative Headache Medicine of New York. She is also an assistant clinical professor of neurology in the Division of Headache and Facial Pain at Mount Sinai's Icahn School of Medicine. And what is important for our purposes today, she happens to be a licensed acupuncturist. Our topic today is acupuncture and migraine. And this is a really interesting topic because people have asked me previously to cover this topic, and it was a little bit difficult because it's not something we have a ton of data on, and it's not something that there are a lot of people out there that are experts in this area that I can interview. So I'm very excited that I found you, and we're going to cover what is known about this topic. So before we begin, I would love it if you could tell the audience a little bit about yourself and why you've chosen to work in the field of headache medicine.
Absolutely. Well, thank you for that wonderful introduction. So I just love headaches. So I feel like how I got here is family. My mom suffered with really bad migraine all growing up. I just remember having to take care of her, putting her in a hot shower, bringing her medicine and ice packs, and just really never addressing it. I know even now as a headache specialist, I'm like, Mom, why can't I help you? I feel like parents maybe are that way. But then also I started developing migraine as I got older. And I think part of a reason why anyone I think becomes a doctor is to understand medicine, also understand themselves, understand family. So I was just always trying to figure out why and how could I help. So naturally, I love the brain, went into neurology, but headache was always really a special place in my heart. And I feel that headache is so misunderstood and that there's just so much that we can do, both with medication, with things like acupuncture, just this whole array that is just not really well presented to the patient. And I just feel like it's just such an art as well as a science. So headache is kind of my whole life and I love it. I couldn't imagine doing anything else.
Well, we are glad you're here and we are glad that you chose this field. So can you start this topic by just telling us what acupuncture really is and the theory behind how it might work for things like pain and inflammation, etc.?
Absolutely. So just generally, acupuncture is a technique that involves the insertion of really fine needles into specific points in the body. And these are thought to regulate the flow or balance of energy. And energy in traditional Chinese medicine is called qi. So what the thought is by taking these really fine needles, you can regulate the balance of how qi or energy flows through these meridians or pathways in the body. So acupuncture points or sites where needles go are areas where qi might be out of balance. So certain disease processes can cause qi to either flow well or not flow well. So when you needle in a certain area, you might remove too much energy in an area that might be congested or add more energy where there's a deficiency. So it really is based on this meridian system of which there are different meridians running through the body and then balancing the energy through them.
Okay. So the first thing that I've noticed that people with migraine will often say when you bring up acupuncture is, I've had trigger point injections. Is it the same thing? Can you answer that?
It's a great question. It is not the same thing. There is dry needling that an acupuncturist can do, which are to break up the tight bands of tissue. Acupuncture has nothing to do with muscle or tightness. It's actually putting needles in specific points on these channels that don't necessarily relate to where you feel pain. So for example, someone might have pain here and I'm putting a needle in your toe. It's for a regulation of energy flow, not to break up tight bands of muscle and tissue.
Okay. So let's get back to the data. I did quickly mention that one of the reasons it was difficult for me when I first started working on the podcast to do a podcast on acupuncture was there wasn't a whole ton of data out there necessarily about it. So what kind of data do we have now for the treatment of migraine with acupuncture? Is it even possible to conduct a robust clinical trial on acupuncture?
Yeah, that's really been the problem. I feel like we do have data, but most of the data is looking not so much at clinical trials, but sort of, I don't know, it's like this conglomerate of and review of other ones that have been done. I feel like if we look at who has been the biggest one who's published, Lindy is one who has published a lot in this space. And there have been a number of Cochrane reviews that have been published, but one in 2016 that basically reviewed 22 different trials with like 4,000 participants and basically compared acupuncture to sham, which we can talk about sham acupuncture, which means like placebo, because sham is never really sham when you're talking about an intervention. And then also compared it to routine care and then to other prophylactic medications. And this was sort of the biggest trial that we have for acupuncture and episodic migraine. And it basically showed that acupuncture was similarly effective to treating with prophylactic migraine-specific medications, more effective than sham or placebo. But again, how much more effective than placebo was, it's not super robust, but similar to medication. So sort of the takeaway from that, and again, I'm talking episodic migraine, is that if it's comparable to pharmaceuticals and has less side effects and people are more willing to comply.
Yeah, so I will continue to talk about how does acupuncture helps in clinic, and then I'll play the video again. So acupuncture can be beneficial for both acute migraine attack or for long-term prevention, and also for episodic migraine and regular treatment can be like help quite a lot, and even for chronic migraine like for 2 to 3 sessions per week, it will be good. And so the common migraine triggers and how the acupuncture may help is that I'm going to talk about this part. For example, common migraine triggers including hormone imbalance, psychological stress, and certain food like such as MSG or artificial sweeteners, sleep disturbance, and environmental factors such as weather change, bright light, and strong odors. All of those can be like common factors. These triggers may activate sensitized neurological state characteristic by increased stress hormone activity and the other stuff. So rather than rely on the solely on trigger avoidance, alternative approach is to reduce the baseline of reactivity of the nerve system so that triggers are less likely to provoke an attack. And acupuncture may contribute this to by modulating stress response, reduce inflammation, and regulate the neurotransmitter balance and stuff like that. Mm. So I will continue and finish the last video.
Extrapolation, then why not offer it?
Right.
So in terms of like evidence for episodic migraine prevention, acupuncture has.
Imagine being able to build an app with your name on it, just by thinking about it. Meet Base 44, a complete AI creation platform.
The best evidence in the migraine space, but I will say it is not superior to pharmaceuticals. It is similar. So take that as you will. I always believe in a combination approach. So
Right.
actually doing both together, again, data might not be there, but I feel like if you're someone who's hesitant about being on medication or who has side effects to medication, acupuncture, the evidence can be similarly as effective.
Okay. Were there certain people in the trials who it helped more than others? Like, I think you were focusing on episodic more than chronic there, or did it help men more than women? Anything like that?
Yeah, so those specific trials were episodic. Chronic migraine has been a lot less studies on it. There were a few, but they haven't shown as robust of an improvement. And obviously it's harder in a chronic migraine population. But I think the studies have shown that results are comparable to medical therapy. But again, we have small sample sizes. I think the follow-up periods were pretty small. They only looked at about 3 months. So the long-term efficacy in chronic migraine wasn't as well known. Mm-hmm. But I would say it still can help just because we don't have the studies necessarily to support it. Doesn't mean that it's not going to be helpful.
Right.
Studies themselves don't necessarily say which patients aside from episodic chronic it will be more helpful for, but in practice and in experience, it tends to be the patients who are able to commit to doing it and have an open mind. I know it sounds silly, like you have to actually think that it can help in order for it to help.
Right.
And we've seen that having that open mindset and sort of just ability to relax with the procedure does influence the results and the impact.
Okay. How about kids? Those of us who have children with migraine know that it can be difficult to get certain medications for them. So I'm just wondering, can pediatric patients undergo acupuncture? And if so, has it been shown to be helpful for migraine at all?
Yeah, I love this question. So yeah, it's actually not robust evidence, but acupuncture can be helpful and has some evidence to show benefit for migraine in children. So it's something that very few people will practice. So I think finding a practitioner to do it might be the rate limiting step. But I do think that using it as a therapy when medications, there aren't that many that are great in kids, they aren't necessarily that well tolerated. I think if the time is there to dedicate to doing acupuncture and the child is open to doing it, I do think evidence can support moving forward and trying it.
Okay. Has acupuncture only been studied for migraine prevention, or has it been looked at in the acute setting? In other words, I have a migraine and I'm going to get acupuncture. Can it help?
Yeah, there's been multiple studies showing that there's some benefit for ear acupuncture, so auricular acupuncture for acute migraine relief.
You can see from the video, the ladies also has been mentioned about ear acupuncture, oxybustion, just like traditional acupuncture. So those are all the good ways to treat the migraine. If you have any questions, you can leave a comment and we can talk about it next time. Thanks for your watching.